give maybe the book definition of sports pharmacy. It's a specialty area of pharmacy that focuses on athletes and active individuals as a patient population. Of course, we have the athletes, but not everybody has to be an athlete. When I started studying sports pharmacy, I understood that we are mostly focusing on a sedentary population. We are trying to treat diseases with the medicines for people who doesn't do many sports or exercise. So sports pharmacy takes athletes as a patient population, but we also work with amateur athletes or active population as our focus group of patients. And the tasks we generally do as a sports pharmacist is to ensuring safe and effective use of medicines, like you all shared, safe and effective use of supplements, medical equipments, also non-pharmacological approaches. I'm sure you may have some herbal treatments and alternative therapies also available in your countries. So that is also where our expertise comes into play. And of course, based on our medicines expertise, we provide pharmaceutical care for common sports-related conditions. We prevent illnesses, we prevent sports injuries, and we mainly protect athletes' safety and also clean sports. And of course, we do not act as an island. We work with sports physicians, physiotherapists, performance nutritionists, sports psychologists. The members of an athlete health care team differs from country to country. But for state-of-art medical teams, you would see, for example, the Olympic medical team consists of more than 30 professionals, from podiatrists to pharmacists to dentists, sports dentists. So we act in a multidisciplinary team. We are members of an athlete healthcare team because it's an interdisciplinary approach. If we deep dive into specific roles of sports pharmacists, just maybe focusing into a little bit more what you have just explained, I can give few examples from what we should be trained, what competencies we should have as sports pharmacists. Of course, athletes are human, and they may be sick too, they may get sick too, and this may be some chronic conditions. So we may provide pharmaceutical care for chronic conditions to athletes. We can help with management of drug treatments, also adverse events, side effects. This was one of the answers that I received. How to avoid performance-hindering adverse events. This is where we can step in. We may increase medication adherence so that an athlete would return to play fastly. If we look at the athlete's goals in terms of healthcare, the only thing they would usually ask for is to perform their best. And if they are sick, return to play as soon as possible. So if this is related to medicines treatment, we would step in here to have the best, safe and effective and most efficient treatment. The other thing we can do is also we can compound magistral therapeutics for athletes. So we can provide more personalized treatments. This could be creams, ointments, and some other products that can help athletes for their specific situation. We can also analyze health data from wearable devices. We are very good data managers by profession. So if we would like to stick with the current trends of digital health, we should be able to read the wearable trends of athlete healthcare indicators and performance indicators. The other thing would be analysis of laboratory tests. It's where also we can understand and prevent diseases and also support with drug-related nutrients deficiencies. So we are also very good in that area to support athletes. I had another slide. Okay, sorry, that moved a little bit quickly. And one of the things you mentioned was the management of minor ailments. So treating athletes with the some of the health conditions that could be treated by OTC products. We are educators, we can educate athletes. Most importantly, we are the experts in implementing anti-doping protocols. This may require some education, but I'll share some of the examples and some resources with you. And also another interesting role that I also discovered when I started studying pharmacy, also Dr. Mark had this very extensive experience in this area. It's management of pharmacy services at sports events, because there are medication management required in major sports events like Olympics or the African Games. So pharmacists are essential to make sure pharmacy services are planned, provided, and maintained in a smooth way. And finally, safe and rational use of supplements is very important, because there are a lot of misinformation going on in the context of supplements. We are the trusted resource when it comes to supplements. So athletes should know very well that we are the safe and trusted resource, both to provide the product and also inform them about getting the most out of these supplements. And finally, of course, summing up this all, we can assess the health and performance of an athlete, of course, after a certain level of education. Where can we practice as a sports pharmacist? We may practice in sports medicine clinics where sports physicians are leading, but there are also multiple other professionals that work, such as physiotherapists. There are various athlete health centers that provide athlete-centered care, so pharmacists can work. So anti-doping agencies, organizations can be local, national anti-doping organization or an international one like World Anti-Doping Organizations. And also, if you're a community pharmacist or a hospital pharmacist, you can still treat athletes, provide pharmaceutical care to athletes. So we can also practice in our own setting as sports pharmacists. Finally, sports clubs, sports federations are also excellent places where we can demonstrate our competencies. Also, academia and research is an area that is developing. We need more research in this area, especially in the context of pharmacotherapy in athletes. And also, you can also provide one-to-one athlete consultancies through teams or in working with individual athletes. And what is the pathway to become a sports pharmacist? I'll give you some examples, but there is no standardized pathway for becoming a sports pharmacist. This is actually a starting point, and I'm very happy that there are so many interested colleagues, seniors here in sports pharmacy. As much as we are going to be curious about this area, it's going to be standardized, because now everything is falling into together. But up until now, there is no specific pathway. But it doesn't mean that you can't learn. There are some opportunities. You may start in the undergraduate level when you're studying your bachelor or PharmD or master, whatever the degree it is in Ghana. There is one great example from USC Men University in US. They just started an elective course in sports pharmacy where they deep dive into physical and performance assessment of athletes, drugs, supplements, and sports pharmacology. So it could be an elective course. It could be also integrated into, for example, toxicology or pharmacology. So it's already there. We just have to deepen it a little bit, but there are good examples. And in the postgraduate level, there is only one program that is available, and there will be more examples, I'm sure, that is coming. And that example is from my country. Gazi University is one of the greatest pharmacy schools in Turkey, and they have launched the first ever master's program in sports pharmacy. I completed this program very recently. I'm one of the first graduates of the program. And of course, it's foundational baseline level program, but I found it very helpful because it was a multidisciplinary program where I was taught by physiotherapists, sports nutritionists, sports physicians, or colleagues or leaders from the Anti-Doping Agency of Turkey. So the examples will evolve, but it's important that we create the demand so that these programs will come up. And I'm sure with leaders like Dr. Mark, these programs would be available soon in Ghana. And finally, I'm sure most of our listeners are already pharmacists. So continuous professional development programs are available. There is one program that I also completed and I highly recommend it, is the IOC certificate. IOC stands for International Olympic Committee. It's an online program, and it's one of the best available program in the context of drugs in sport. It's mostly focusing on anti-doping efforts and working with elite athletes because it's the Olympic Committee's program. But it gave me great insights on, for example, how to manage an asthmatic athlete or how to manage a diabetic athlete. These were something that was extremely specialized, having athletes as patient population. And also I significantly increased my anti-doping competencies. Strongly recommended. It's available on IOC's website, and they open the course in every 6 months, as far as I remember. So the next one might have just started, but the next one would be in February. As soon as, if you have any questions, feel free to reach out to me. And finally, the pharmaceutical societies of your country or other countries may provide specific programs. And one of the best example is from the Japan Anti-Doping Agency in collaboration with the Japanese Pharmaceutical Society. They have developed the sports pharmacist concept for the Tokyo Olympics years ago. And this is where they also developed the concept of a sports pharmacist. I think it's even the trademark. They owned the term sports pharmacy. So they educated every pharmacist in the country, and from their system, a citizen from Japan would check which pharmacy closest to him or her has this capacity, and then they can go to that pharmacy to get sports pharmacy services. So you can also get courses available from your pharmaceutical societies, or also programs like IOC. Also, there are free programs available. You may go into World Anti-Doping Agency's ADEL website, ADEL. There is a freely available program called Medical Professionals Education Program. Very good in that program in the context of anti-doping. But I think as pharmacists, you don't have to call yourself a sports pharmacist, but an athlete would come to your pharmacy, and you would add significant value if you know the anti-doping protocols. So this course is freely available. It's very easy to complete. I recommend this to everybody. The certificate you see is from my own country's, Turkey's Anti-Doping Agency's education program. So I also completed both to improve my anti-doping capabilities. I really enjoyed this course. Also, as an amateur athlete myself, it was very educative. So strongly recommended to get also freely available courses. Also, there are international organizations available that you can be part of. They're freely available, provide freely available resources that you can improve and top up your skills. One of which is the International Sports Pharmacists Network. It's led by Dr. Ashley Anderson from US. Sports RX Network is also another group that develops free resources, freely available resources, and also some fact sheets that you can improve your knowledge. And also finally, there is the US Sports Pharmacy Group that also has an international working community. I'm active in all of these organizations, and this is how I also improve my competencies, just being a part of these organizations. Visit their website, and you will also have access to many information. I also want to share an announcement. This announcement you see is from last year, but we are organizing the next International Sports Pharmacist Symposium. Follow International Sports Pharmacist Network on LinkedIn. That's where mostly the organization is active. We are also planning to organize another online symposium on sports pharmacy, where we will have leaders across the world speaking about specific topics. So stay tuned and follow. So this is also very affordable, sometimes even freely available symposium. So I'm sure if you're interested, you would have so many things to learn. That's how I did in the last 2 years. So I'll start to, I'll wrap up. I told Dr. Mark and Reginald that I like talking, so I'll slowly stop talking. but I'll finish with sharing my own experience as a sports pharmacist at the Race Walking World Championship, which was held this year in Antalya, in my country. I worked for the World Athletics, representing Turkish Athletics Federation. So I'll just share a few of my photos and the tasks that I led. I volunteered at this event, and I volunteered and created my own opportunity. When I heard that the event was organized in my own country, I stepped up and asked for opportunities. And what I did was basically doing the pharmaceutical planning, which medicines would be needed for athletes, but also for the all accredited personnel. And I also set up my pharmacy. What you see is my small mobile pharmacy. Of course, we didn't have all the medicines, but they were the essentials. I also supported with building the medical tent. What you see in the left photo is an inflatable heat stroke pool, because it was an event which was held during a very hot weather conditions. So I learned about the protocols in heat stroke to athletes. And I also supported mobile teams with providing essential medicines and medical equipments in their bags, because they were all around the area where the race was held. I also provided pharmaceutical services, just was a video, pharmaceutical services to all accredited personnel. What you see is the athlete area, and this was during the competition, but there were supporters, also trainers, and also observers and workers who built the area. So we provided services to all of them. Also, I provided medicine and health consultancy as a pharmacist on the field during the event. I was responsible for keeping electronic patient records. This was a system called RaceSafe that was developed by the World Athletics. As I said, we are very good data managers, so this was my responsibility as well. And of course, traditional pharmacist responsibility, stock management, and supply. I work with a local pharmacist in Antalya, and I supported with the stock management and supply. It was a great opportunity to serve Olympians from around the world. You see the Italian team who went to Paris Olympics. This event was in May, and it was just a unique experience to observe these athletes. They are incredible. And finally, it was a unique practice experience. I made new friends, new connections. Who you see in this picture is sports physicians, physiotherapists, psychologists, nurses, and also the director of Turkish Olympic Committee on the front. So that was an excellent opportunity. My take-home messages was, as a sports pharmacist, because this is an emerging area, I had to pursue and create my own opportunity to demonstrate my competencies. Nobody called me, but I went there and I created my own opportunity. So that's an important message. And I saw they need us. They need sports pharmacists. They found the medicine-related tasks very challenging, which was very easy for me because I'm just a pharmacist. I'm educated. So they need us, and we have to be confident that they need us. And serving elite athletes requires specialized skills. They are not traditional patients. They have different physiological state. They have other needs. So I had to be educated to support these athletes. I had a case for you, but I'm skipping this because I'm probably running out of my time, but maybe in another event. So I was just going to test your knowledge. But finally, I think I started my sports pharmacy journey in 2023, and this is my second year. And what I learned is I had to pitch my expertise to different colleagues, not just in the world of pharmacy, but I had to speak with Olympic Committee. I had to speak with sports physicians, dietitians, many colleagues, just to show what I know, because they don't know what I know. And then through that, I am trying to become a trusted resource in my current setting. I practice in a community pharmacy, and I always speak with my patients. I always ask if they look a little bit fit. I say, are you an athlete? They say, yes. Oh, this is the services I provide in this pharmacy. Would you be interested? And they get surprised. So then they trust me and they come and they ask me. So it's another thing you can do. Just start with your own journey and volunteering at sports events, athlete clinics, anti-doping or activities of sports events is a great way to start. This was what was recommended to me by Dr. Ashley Anderson, also another supervisor of mine, Somer Helvacı, who just worked for the Paralympics at Paris. I follow their steps and it's working. So I recommend to you as well, but it's a marathon and it's taking time. I'll just wrap up with your take-home messages, like maybe 2 minutes. Again, I'll ask you to go to Menti. We did this before with just another quote, maybe 1, 2 answers. I just wanted to read, but you can do it at your own time. I'll wrap up my presentation, but I want to see your answers and feel free to, I'll just stop this and start Menti and wrap up my presentation while I launch Menti. Just maybe at your own time, if you can share your answers with me, I would be happy to see what type of perspectives there are from my aspiring sports pharmacist. The Menti is on, and I'll wrap up my presentation. Just a second. If you'd like to stay in touch, you may follow me on Instagram, LinkedIn. We also have a podcast with one of my fellow sports pharmacists, Jessica Beal-Stoll. We hold this podcast on various platforms. You can also use that as an educational opportunity. We speak about supplements and some key athlete health related topics. And also you may reach out to me through my website. I would love to stay in touch with all of you. Thank you very much for your patience. Thanks for having me. And if there are any questions, I'll be glad to answer. And I'm just very pleased and honored to share this stage with Dr. Mark. It's my pleasure. I'm very happy to be connecting with all of you. Thank you very much.
Thank you so much, Dr. Nilan, for the insightful presentation. I've learned a lot and I'm getting interested in sports pharmacy. I would see what would happen in the future. Please, if you have any questions for Dr. Nilan, kindly put them in the chat box and they'll be read out in due time. However, I would like to move to the next session while we wait for your questions. So please let's welcome Dr. Mark to take over and have his session. Thank you so much. You're welcome, Dr. Mark.
Thank you very much. And many thanks to Nilan. Awesome presentation. Basically, she has shared what we do as pharmacists globally, nationwide, and where the journey starts. I believe we are all pharmacists or people associated with pharmacy. So I'll also just spend a few minutes talking about what I do as a pharmacist, how I got here, how they pushed me under the bus and I had to survive. But it's an interesting area of specialization that is not common. And initially, you don't get respect, but once they get to know who you are, things become a breeze. So a lot of the things on my slides, she has already mentioned, so I will skip those when I get to it. And all right, can you see my slides?
Yes.
Okay, all right. So once again, my name is Mark Dradusi. I'm the fellow of the Ghana College of Pharmacy and then also a fellow of the West African College of Pharmacists. I consider myself a clinical pharmacy specialist. I got into sports pharmacy back in, say, 2008, 2009, when I was an athlete, a sportsman. And for those who know my history, I used to compete as an elite athlete. I ran for Ghana as a junior national athlete. I was a long jumper. I competed for my school in the US. So I got to the point of being ranked in the world as a jumper. That was even after pharmacy school. And then I ran competitively for Nike. So Nike was my sponsor. And so I went through the hoops of being an athlete who used medications, an athlete who had to deal with nutritional issues, an athlete who had a clinical psychologist, an athlete who got injuries and had to take medications, an athlete who had to be tested multiple times for anti-doping to check to see if I had substances in my body, both at competitions and then what we call the out of competition testing, where you'll be called and given a time to show up and then for a sample to be taken and be tested. So I went through all that, but how did I get into sports pharmacy? In my elite competition days, I happened to be around a lot of professional athletes and fellow athletes who will just walk up to you once they get to know you're a pharmacist and they ask you questions like, can I take this drug or can I take this supplement? Is it going to show up in my urine? Am I going to test positive? Can I eat this food? What can I eat to improve my performance? And so many what. And I started thinking, but well, I'm a pharmacist, I deal with drugs. Why nutrition? Why sports performance? Why this? So it kind of caught my eye, even though at that point, I just offered the information. I had people with chronic conditions that would come to the pharmacy, and then upon questioning, you realize that they play a sport one way or the other and they get tested. So that somewhat is how I got into sports pharmacy. I was very fortunate to have had a good pharmacist during my days as an athlete who also advised on some of the supplements or the medicines I had to take. And during my injuries, also being there supportively. So I was quite exposed to the sports medicine arena. So so she did explain what sports pharmacy is, so I will not go over it again. But we do work in conjunction with other healthcare specialists and specialties. It's a holistic approach to sports or to patient care. One thing I have to say is that as a sports pharmacist, we do not only deal with athletes, and it's really part of our work. So, for example, some of the international competitions we go to, or for most competitions that you go to, you end up having to, like Nilan said, deal with the officials, injured, what do you call it, officials from countries or even referees and all of that. So basically, you are not only there for the athletes, but you do have to deal with everybody. African Games, we have to deal with drivers, volunteers, and everybody else. And that sometimes presented a big challenge because you're there thinking, oh, I needed to only deal with athletes. You order medicines, and then you have to order medicines also for people with non-communicable diseases, hypertension, asthma, and all of that. So it's quite interesting. It's a very, sports pharmacy is a developing subspecialty. So previously, most people would just learn on the job, but now there are new learning areas. She mentioned the WADA, World Anti-Doping Authority, ADEL learning platform, IOC, Certificate of Drugs in Sports, and so many other master classes, programs, diploma programs, certificate programs, and webinars that will help strengthen the pharmacist in the area of sports. So we do meet the needs of the athletes regarding medications, nutritional supplements, advice, and other things. For where I was, we didn't have the full complement of sports medical practitioners. And so I was somewhat forced to also learn quite a few other things. And that included support in nutrition, support in the supplements, and also now manipulation. So I had to learn about how to deal with minor ailments and then doing massages and all of that. So as pharmacists, even though that is not one of our core areas, especially in the areas of sports manipulations, there may be times that if you're able to have the time and learn and get a certificate in that, you can perform that task. So athletes were unique patient populations, but we had to deal with others as well. Main responsibilities are things you went over that, so I will not talk much about it. FIP, so you're thinking of sports pharmacy. Does anybody else care about this? FIP does have a full document on sports pharmacy. So it gives you information about what we do as pharmacists, getting up-to-date information about the content of the WADA code. So one of my roles as the playing a medical commissioner role with the Ghana Athletics Federation is to make sure that every year or periodically I share the World Anti-Doping Prohibited List. That is the banned drugs list to all the athletes, to all their platforms, to all their leaders. I do education to both the federation heads, the coaches, the athletes themselves, and a host of other things. I do programs that promote health, fitness, exercise, and I also answer a lot of the questions they have. So I serve more like a go-to person when it comes to anything that has to do with medications. And this is not only for the athletes who run, but also the boxers, tennis players, and other disciplines. Once they get to know you are or you know something about medications and anti-doping, they will reach out to you. Talk to people about rational use of medications, things that will help prevent abuse and all of that, supplying medications to them or promoting or helping with them to get medicine that they need when they are injured, keeping records, and so many other things. So she mentioned working fields. Nilhan mentioned working fields for athletes. So sports clubs and associations, so keep fit clubs, national federations, and all areas where sports is played, you become, like she is, Nilan is a consultant to athletes. Yeah, so as a sports pharmacist, you can actually be a consultant to athletes and you are paid for doing that work. And the range of the duties you play range from so many things. You work for anti-doping organizations, or you work with teams that manage doping. So in my case, I was involved in the setup of the Ghana National Anti-Doping Organization. So until 2014, 2015, Ghana did not have a National Anti-Doping Organization. So we were tasked by the Ministry of Youth and Sports, a committee or set up of, I think, were 8 or 9 of us to set it up for Ghana. And then also National International Sports Federations, being a member of those, you play a health role. And then we're also involved in doping control. So for example, for the African Games, aside from the other roles I played a role as one of the people who were on the therapeutic use. And in therapeutic use exemption, basically there are medicines that are prohibited for regular use in competitions, but some athletes may develop a medical ailment or condition or disease that requires that we use that particular item. And so there's an approval process that the patient, the athlete has to go through. And then so they need a pharmacist, they need a physician, they need all kinds of people on that committee who go through what is presented and then make recommendations as to if the athlete should be approved to use that substance or not. There are times that actually the substance is used on the athletes before it even gets to us, and then we look at it and then deliberate and then advise on if the athletes should be continue to go compete or be banned or whatever. So it's a very sensitive committee that pharmacists have a role to play in. And then sporting events, Nilan showed pictures of some of the events she's been to. I've also been to some international events, Commonwealth Games. I've been to African Games, All African Games, national championships, and a host of other places. So it's quite an interesting thing to do. I also play a big role in my facility where I work. We have a FIFA accredited rehab center. So I play a big role there in terms of helping with medication management for a lot of the athletes that come through, and also doing a lot of education there. Let's see. So anti-doping. So I'm sure as pharmacists, we all know what doping is, which is the use of any foreign or physiological substance to artificially or unfairly enhance performance. So this is why we test patients, and and people take all kinds of things just to get by and then cheat. So anti-doping is a big deal. Clean. There are so many organizations now which are pushing for clean sports, basically preventing people from cheating. So pharmacists are very well involved in this. So what do I do as a pharmacist, or as a sports pharmacist? It all started as an athlete. I got exposed and then I got interested in doing that. Then I got the degree. My PharmD, we were taught a little bit of sports pharmacy during PharmD, and then I worked to improve on that. So combining pharmacy with sports was interesting. I was tested several times as an athlete, so at least I got to know how things work in the anti-doping sector. But then I had to now go and improve my knowledge through a lot of the EDEL courses, and then also master classes and exposure to people that I work with. So how did I obtain my knowledge? Lots of certificate programs and diploma programs. I mentioned the WADA program. I didn't get to the IOC program, but I'm still looking forward to doing the IOC certificates of drugs and sports and getting certified in that. Webinars, master classes, short courses, and there are lots of those online that you can do. And then also with some organizations, Nilan mentioned a lot of the universities that also offer sports pharmacy, and I can share some of those as well. And then specializations that can also be done. Oh, sorry, there's some feedback.
Good evening.
Is it better?
So
All right, so I'll get through quickly. I think I'll be done shortly. So other specializations for pharmacists. There are courses in nutrition. There are courses that in sports performance, use of supplements, use of foods, and all of that. You can also specialize in anti-doping, and then the treatment of minor ailments in sports. And then aside from that, there are also, you also support a lot of the doctors in the management of non-sport related diseases. So for example, one of the, actually quite a few of the international competitions we attended, we had people who had developed diabetes, or people who had asthma, people who had all kinds of ailments that pharmacists had to support in their management. And what happens is usually in most of the sporting areas, most of the sports medicine doctors are not very strong when it comes to management of non-communicable diseases or non-sport related diseases. So that is where they rely a lot on pharmacists. And especially if you are really good with guideline dosing and management, they do rely on you for that. So what do I do in Ghana locally? So I advise sports medicine on medications and supplements with the Ghana Athletics Federation, Ghana Olympic Committee, Medical Subcommittee, Ministry of Youth and Sports, traveling with the national team, setting up of the National Anti-Doping Authority, assigned to certain sporting disciplines. With the African Games, I played a major role, being part of the LOC, the Local Organizing Committee, Medical Subcommittee, part of the African Union medical team as well, and then all involved in the whole setup of the pharmacy aspect of the games, writing the games pharmacy manual, as well as assisting in the writing of the games medical manual, training of personnel for the games, both pharmacists and medical officers, and then organizing logistics, like Nilhan said, medications, consumables, and setting up the whole pharmacy system, sending out teams every morning to various competition sites, doing a lot of monitoring. I was part of the critical care team. So Nilhan showed a place where they had an inflatable heat stroke pool. We were involved in all of that as pharmacists. So we do have a big role to play when it comes to sports pharmacy. With just a little bit of push, you can get all the certification you need to get, and then opportunities do come. So my take-home messages, it's a very big and new emerging area of specialization. There are opportunities there to advance your knowledge, opportunities to grow yourself, opportunities to meet people. And the funny thing is that when you go to these competitions or these areas, anytime you participate in any sporting event, you make lifelong friends. people that become friends because especially once you travel for competitions, you meet them everywhere and it becomes a network. So take home message, get involved, make a difference. There are lots of opportunities out there. Thank you. So we are ready for any questions that may come up.
Thank you so much, Dr. Mark, for the insightful presentation. Please, if you have any questions, comments, kindly put them in the chat box and they'll be read out. I'd like to invite Derek Peku Eshen to give a couple of announcements and then we have the questions. Thank you.
Okay, guys, good evening, everyone. Please, I hope you are doing well. Thank you all so much for joining me. So please, we have some few announcements. Firstly, I want to draw attention to a program we're having tomorrow on X, formerly called Twitter. So we'll be having a session with our chairperson, Farm Reginald Sechi Brown, on literally every day. There's an open forum for us to engage our chairperson. So please, all young farmers and all on the call are invited and expected to be there to ask all the questions that they are really they really want to ask the chairperson. And then also, please, we have during the AGM, which is 24th to 27th in Kumasi or Seiko, if we are going to Kumasi, So during the ECPG session, we are going to have a very interesting open forum. So please, all ECPG members are urged to be there and ask their questions. All are expected to be there to ask all their questions. It's an open forum, a chance for us to engage the stakeholders, a chance for us to bring ideas to help push the young pharmacists, the career of young pharmacists forward. I think for now, that's the announcement we have. Our chairperson would like to add 1 or 2 announcements to me. Thank you all so much.
Thank you, Derek. Okay, so in the absence of any questions, I'd like to acknowledge the presence of Dr. Madu and the entire PANS Pharmacists Association of Nigeria for being here. Dr. Madu is a chairperson of Clinical Pharmacists Association of Nigeria, and I'd like to invite him briefly to share a few comments on the presentation. Dr. Madu.
All right. Good evening from Nigeria. Please, am I audible enough?
Yes, sir.
Loud and clear.
All right. Thank you very much. I must say it's a very wonderful presentation, and I thank God that I'm able to attend the lecture, both lectures by Dr. Mark and Dr. Nilhan Usman. I've been able to get the personal contact of Nilhan Usman. I would like to have that of Dr. Mark, because since I'm a chairman of a national body, I'm very much more interested in maybe helping my members to get trainings, particularly on the IOC certification and other certifications. And I want to thank Dr. Mark for one of the statements he made, whereby he said, try and get all the certifications, opportunities do arise, and so on and so forth. I think that is a $1 billion advice. I thank you so much. I've learned so much this night, particularly in the area of sports pharmacy. In Nigeria, the Clinical Pharmacists Association of Nigeria has some specialty groups, about 15 specialty groups, patterned after UK Clinical Pharmacy Association or the American College of Clinical Pharmacy specialty groups. But then we do not have anything maybe in the area of sports. And since it's still a developing area, I think I was developing specialty, I must say. It is very interesting and we would like to learn more about this. So I would like to have the contacts of the presenters this evening. Thank you once more very much, and permit me to also thank the ECPG leaders. We have been able to be in contact with pharmacist Seki Brown, and he invited us to this lecture this night. Thank you for giving me.
Thank
Thank you,
you.
Dr. Madu. And
Yes,
we're
thank you,
grateful.
Dr. Madu.
I've shared my contact information, please, in the chat box.
Thanks a lot. I've seen it.
You're welcome.
Thank you so much. Please, we'll move on to another comment. We have the presence of the GOSPA chairperson, Farm Dr. Oriafi, and would like to introduce him, welcome him to give a few comments before we go into the question section. Thank you.
Okay, yeah. So thank you to ECPG and thank you, Farm Reginald. It's a very wonderful presentation. I have personally learned a lot. And I think we should collaborate appropriately so that we can train a number of pharmacists in this specialty. It's very good. I mean, it's good for us to explore all the avenues available, and it makes us better individuals to be able to, practice appropriately. So, Dr. Max Dardodi, thank you very much. And then our honorable colleague from Teki, I mean, it's very wonderful. Thank you.
Thank you so much, Farm Dr. Oriafi. So we are going to move straight into the question section. I have one question from Gideon Mensah. The question reads, please, what are the minimum requirements needed to apply to be part of Ghana Sports Medical Team as a pharmacist? I think that question would go to Farm Dr. Mark.
All right, thank you. So if I heard you right, he's asking what the minimum requirements are for a person to join. Is it like any of the sports teams or any of the sports programs?
Yes, please, that's the
okay. So I'll start with the African Games. So for example, African Games, the minimum requirement was just a pharmacist. Because this was our first one, we realized we didn't have a lot of sports-trained pharmacists in the country, but we spent the first, at least the first 2 days, we spent some time, let me just say, we spent some time training before we started working on some basic things that a pharmacist must know. If you want to go higher into bigger roles, then you will need to do some extra certification or extra learning to be able to cope. So one of the, for example, for Ghana, one of the things I requested from everyone was at least to visit the World Anti-Doping page, a DEL learning page, to at least get some of the courses done for the medical professionals. That is a good introductory part of it for you to know what is involved in management of athletes. Then also, depending on your area of the type of sport, you will have to learn a little bit about it. You have to learn a little bit about the type of injuries that happen in that area, type of illnesses, let me use illnesses, that to cover everything. And then a little bit about anti-doping. You should know about anti-doping. You should know about the doping code, the medicines or the prohibited lists. And then, but once we plan to go deeper, then you have to really advance your knowledge, especially even also in nutrition, the supplements, what is banned, what is allowed, what is not allowed, the different processes. So one of the things about our job is advising and then directing your athletes on the right ways to deal with certain things, especially when it comes to medications, the therapeutic use exempt and things to prevent being tested and then testing positive or doing doping and all of that. So yeah, so you will need to really upgrade your knowledge if you really plan to go deeper. But just for regular competitions where there is a trained person, just your pharmacy degree and a little bit more knowledge can suffice, and then we build up capacity after that.
Thank you
But
so
I have
much.
to say
Dr. Mark.
that international programs do require certain competencies to be met. So I just wanted to add that to it.
Okay, thank you. So we have a second question from Jones Agwe-Kwadri, the University of Ghana Students Pharmaceutical Students Association president. He's asking, can a bee farm, also do sports pharmacy, or is only available for Farm D candidates or Farm Ds?
So Nilhan, do you want to take that?
I think Dr. Mark would
Okay,
answer.
yeah, both of us want to, but Nilhan, since she did the master's in sports pharmacy, probably touch on that.
Yeah, so thank you for the question. The program that was available, because this is in Turkish professional setting, we've graduated with a B.Pharm degree in Turkey. And the program was open to anyone, Turkish pharmacists who complete B.Pharm. And then you don't graduate, of course, with an M.Pharm, you become a Master of Science. That's how it is in Turkey at the moment. There are no standards of profession at the moment, no criteria. Unfortunately, it's a subspecialty, and you may see that it's very easy to call yourself a sports pharmacist. I don't get because I completed the master's and I've completed the IOS program. This doesn't mean that I'm a sports pharmacist, but for the ease of demonstrate what I'm specialized in, I use this title. But at least for professional ethics perspective, because there are no standards, you would be expected, from my perspective, to understand exercise physiology, to understand sports pharmacology, and then also understand anti-doping protocols in your own country and in the world. These would be essentials, because when somebody exercises, the most basic thing you would know that a resting heart rate drops. So there are many other physiological changes. And if you introduced an athlete a certain medication, then you would get a different response compared to normal population. So it's, for the sake of professional ethics, it's good to understand gain few competencies. Dr. Mark shared that FIP has a great resource on sports pharmacy. It's freely available. I'll share the link from chat in a while. That would be used as a starting point, where it says what would be the foundational knowledge that the sports pharmacist would have. That would be a good guide. And that guide can also inform developing professional development courses in your own country, if you're interested. So that explains the standards very well, but I try to give a summary. I'll share the link from the chat now. Maybe Dr. Mark would like to add a few other points as well.
So I side with Nilhan on what she said about entries. There are no requirements. So a B.Pharm holder or a PharmD holder both can go into sports pharmacy. Thank you.
Thank you so much. Please, I have a question for Dr. Nilhan. It's given your experience with the International Pharmaceutical Federation and the Olympic Committee, what global best practices can Ghana adopt in creating a structured pathway for sports pharmacists? Dr.
Thank you.
Nilhan.
Thank you for the question. I think education is essential. So there are many good practices from around the world in the context of education. Japanese anti-doping organization sports pharmacy program. There are examples from US, especially Finland has great examples. In Turkey, we have a course structure that was used to develop the master's program. Engaging with colleagues from abroad to maybe set up a foundational course on sports pharmacy. This could be even undergraduate level, doesn't have to be a full master's program, but few modules of sports pharmacy development, professional development course would be essential to start with. And then from there, when the competencies are there, when there are few sports pharmacists are ready to serve, then the other best practices could be implemented, maybe under the leadership of Dr. Mark, because he has extensive experience. And also another perspective would be if we start from where we are at the moment, if there are any community pharmacists, maybe you can also start developing sports athlete healthcare services in your pharmacies, where they can ask all sorts of information, whether anti-doping, whether supplements, or how this medication would affect my performance, etc. So you would start to answer these kind of questions. Having existing community pharmacists to become health hubs for athletes would be also a good practice to start. This is what Japan did, basically. That's all, I guess. If there are any questions, happy to answer.
Thank you, Dr. Nilhan. We have another question for Dr. Mark. And the question is, given your clinical experience and your involvement in the sports committee, what unique challenges have you encountered in applying clinical pharmacy principles to sports?
Unique challenges. So I think, first of all, most practitioners didn't know that pharmacists had a role to play in sports pharmacy and in sports at all. So initially, when you go and then they see you as part of the team, they're like, what are you doing here? So I had a lot of, what are you doing here? Questions, or why is he here? Until I start speaking, or I don't try to explain myself or to try to impress anybody. I just focus and do my work. And then later they come running to you and say, oh, and by the way, can you help with this? Can you help with this? So yes, so you will have that pushback a little bit, or I would say it's just more because they don't know what your role is. But we try to stay focused on the sports aspect and not veer into somebody else's lane. As in, don't go do a physiotherapist work if you're a pharmacist. If there's a sports nutritionist, unless there's collaboration, just focus on medicines. But once they get to know that you are there and you have the knowledge, they do actually come to you and you're accepted, and then they work with you. So a good example is my first experience with the 2014 Commonwealth Games in Glasgow. I was part of the medical team. We developed the medicines list. Actually, before I got there, they had the doctors, the physios had developed the medicines list and everything. Then I got in and looked at the list and I said, oh, I think we should add this and this and that. And they're like, who are you? And so initially there was a little pushback, and then I called back, but then I read issues started coming up, and then I came forward, and I was really more of like the clinical person there, because we had a sports medicine specialist who was more into orthopedics and the muscle So when we had somebody with an asthma, we had somebody with diabetes, we had somebody come up with hypertension, a sportsman with hypertension, they were totally lost about how to manage. And then I stepped in and said, we can do that. And then so quickly they accepted me and then things went well. So these are some of just the minor challenges. But sometimes it takes a while for people to accept you because you're just not part of originally what their groups used to be. Nevan, any experiences on that? Hello, Nelan.
That was
Any
a question
experience?
for me.
I
Sorry.
was asking if you've had any experiences with difficulty
Yes.
integrating.
I found what you explained very similar to my experience. Although I had one experience working in the race walking championship, everybody was very welcoming, and I stepped in with my competencies, and everybody was a volunteer, so there were not much internal competition. But when I also approached to some other organizations, it's very hard to explain that a sports pharmacist is essential. They usually confuse with sports nutritionists and taking out the medicine's expertise. And then the other thing was that, you know, sometimes sports physicians are leading the area at the moment. So sometimes they see it as unnecessary or a threat. So it's my goal is always to demonstrate that I'm an opportunity rather than a threat. But it's been challenging. And I even prepared myself a booklet called Sports Pharmacy, and every engagement I do with any organization, whether it's an Olympic or a federation level, I always go prepared to the questions they may ask, and then that become effective. As I mentioned, it's a marathon. I'm ready to run that. So I truly understand the difficulties you faced, and it's very similar.
Thank you. All right, any other questions?
Yes, please, there are a few, but
Okay.
I'd like to acknowledge the presence of some important guests that have graced the occasion. So we have pharmacist Dr. Claudette Diogo. She's the Family Planning and Logistics Officer at the Ghana Health Service and is currently the acting National Family Planning Program Manager as well. And she's here with us. Thank you for joining in, ma'am. And we have the President of the Young Pharmacists of Nigeria, Pharmacist Joseph Azige. Thank you for joining in, sir. We have the presence of Farm Doctor Mrs. Gansa Luchot. Thank you for joining in. And we have Prof. Isaac Ayensu, first full professor of pharmaceutical chemistry, KNUST, and he's here with us today. Thank you, sir, for joining in. We have with us Auntie Cynthia, Farm Doctor Mrs. Cynthia Yeboah-Mensah from the Pharmacy Council present with us, and we appreciate your presence. Please, we'll take a comment from the chat box. Mr. Alexander says, interesting presentation. I had a call from a Gambian wrestler a couple of days back who wanted counseling on medication to help him keep fit through his career. This presentation has been really educative. We'll take 2 more questions and then we wrap up. We have a question to both panelists, to both speakers, and it says, what are the key nutritional and medication considerations pharmacists should be aware of when managing athletes, especially those recovering from injury or preparing for a competition? Thank you. Should I take it again?
Yes, please.
What are the key nutritional and medication considerations pharmacists should be aware of when managing athletes, especially those recovering from injury or preparing for a competition?
All right, so I will start with it. I'll take that first. So it will depend on several factors. With nutrition, it will depend on if the athlete is actively in competition, actually both the medications and then the nutrition. So if actively competing or if it's off-season as in it is not within the competitive period and they're just training in readiness for the competition, it will depend on the type of injury or ailment they're recovering from, and then what type of treatment they are getting. Medication-wise, definitely we look at medicines that will not make the athlete test positive. And I have to say that there's a new trend where practitioners are being sued by athletes for giving them medicines that have maybe will end their career or make them test positive for something. So there are medical legal issues to also consider here. So safety of the athlete, safety of the medication product, the effects that the medicine will have on the athlete in terms of the type of treatment they are getting. If it will make them, if they are actively competing, and you don't want to prescribe something that's going to make them drowsy, and all of that. So there are so many things we take into consideration. In terms of nutrition, you don't want to give them or recommend nutrition that's going to help them gain weight if the weight will affect their performance, or nutrition that will hamper their performance. There are some types of foods that athletes are not supposed to eat or are supposed to eat in moderation. So those are some of the things we look at. So there is eating for performance. There are types of foods or food products that. So those are some of the things, and then also eating to help with recovery. So there are so many things we consider when it comes to that, but treatment or those things are also very individualized. It's not a one size fits all. So we take it athlete by athlete, ailment by ailment, whatever is happening. We take it one factor at a time. Thank you.
I can also add, thanks for Mark. I think we covered everything. The other thing I also wanted to add is sometimes athletes underfuel, they don't eat enough, and then this may result in overtraining syndrome, which basically the athlete is overusing his or her performance, his or her energy, and this may also lead to develop further injuries or illnesses. So that's would be also we have to be very vigilant to understand if this occurs, if the athlete is underfueling, because sometimes they lose their appetite, etc. In that case, also they turn into supplements more than foods like macro or micronutrients. Supplements are supplements. They can't replace food. So it's also good it's also important to give this message to athletes that they should first start with proper nutrition, proper recovery, proper sleep, hydration, and then supplements, etc. comes next. And when it comes to medicine, like Dr. Mark said, it's very important about the prohibited status of that medicine. If it's in competition, out of competition, there are different rules. So it's important to follow and adhere to those rules. And maybe one athlete from Gambia called you, or your own athlete from Ghana called you from US and asked, I'm sick, can you provide me a suggestion for one medicine that is that doesn't have any prohibited substance in your country, may be different in the other country. There is a case for that. There is Vicks inhaler. I don't know if this is available in Ghana. It's basically like this size inhaler that you smell, and it has menthol in it and camphor in it. But an athlete took this either in UK or in US, which had stimulants in it, and the athlete tested positive for it. So if an athlete is abroad and asks advice from you, you have to check the ingredients of the medicines, active ingredients. And there are these kind of specifications that you have to be aware of. And the other thing is, if an athlete is vegan, vegetarian, have some food intolerances, etc., You have to understand if any nutrient depletion is existing in the athlete, or if the athlete is on certain treatments, like, for example, SSRIs, etc. This cause dehydration problems in the athlete. So you have to address this kind of side effects before they happen. So it's very individual, like Dr. Mark said, and it's fun to find out these specifics and help the athlete to perform his or her best.
Thank you so much. That was the last question.
If I can add just a couple of things, please.
Thank you.
So one of the things I always say for patient assessment is good history taken, good initial assessment. On the field, what we find is as soon as somebody goes down, everybody's rushing and trying to start therapy or start some type of treatment. But one of the things that all global guidelines or protocols request is for you to get a good assessment, do a proper assessment and good history before you start manipulations, unless it is one of those very emergent, very emergent, and then you will need to do something first, like chest compressions or something. But if it's something that you can speak to the athlete, get a little history, get a very good history before you start treatment, and that will help you come up with a lot of ideas and suggestions on how to manage the condition. Thank you, Nelhan.
Thank you so much, Dr. Mark. Thank you so much, Dr. Nelhan. So this is the end of the question section. That was the last question answered. And I'd like to invite the President of Young Pharmacists of Nigeria to share a brief remark with us, and then we take the closing remarks.
Okay, good evening all. As earlier introduced, I'm pharmacist Azige Joseph Darius, the National Chairman, Young Pharmacists Group Nigeria. I'm pleased to be here this evening, even though I joined late. I think because of the time differences between Nigeria and Ghana, I couldn't keep up to the exact time for the program. It's my pleasure to be here, and I have been well impacted. Actually, we've been in a lot of interaction with pharmacist Reginald and a few other people from Ghana, trying to see how we can bring a collaboration between pharmacists in Africa. You know, when you look at a continent like the Asia, you look at India, their population, you look at China too, they have a very large population and they are given results. So we've been looking at how we can bring or we can cross-fertilize the countries in Africa and improve ourselves by ourselves. And this kind of programs are ones that can go a long way, bringing that desire that we have into reality. I'm happy to be here. I am assuring you that when next this kind of program will happen, please just let us know in time so that we can do publicity, good publicity here in Nigeria, so that if it will be permissible, people from Nigeria would like to join so that we learn all this together. And I'm saying this vice versa. If there are some here in Nigeria, we'll let you know so that we get to learn together. Thank you very much. I'm pleased to be here. Thank you, our facilitators from here, from Nigeria, have been impacted. Thank you.
Thank you so much. I'd like to invite Shalom Adelaide to give the closing remarks. Thank you.
Hello, good evening, ladies and gentlemen. As we draw our enlightened session to a close, I would like to take a moment to express our heartfelt gratitude to our esteemed speaker, speakers, Madam Neilhan Usman and Dr. Mark Dradowski, for their invaluable contribution to today's discussion on Beyond the Game, the role of the pharmacist in athletic excellence. Madam Neilhan and Dr. Mark, your insights into the intersection of pharmacy and sports have truly broadened our understanding of how pharmacists play a crucial role in enhancing athletic performance while ensuring the safety and well-being of the athletes. To our audience, thank you for your engagement and thoughtful questions. Your participation has made this event even more enriching. We hope that you will leave today with a deeper appreciation for the responsibilities and opportunities that pharmacists have in supporting athletes. And lastly, I would like to say a special thank you to the ECPG executives and everyone involved in the organizing of this event. Your hard work and dedication have made this gathering possible. Thank you all once again, and we look forward to seeing you at our future events. My name is Shalom Adelaide. Do have a great day.
Thank you, Shalom. Thank you, everyone, for joining in. I'd like to acknowledge the presence of Prof. Frances Owusu-Darko. Thank you for joining in, ma'am. And thank you, everyone, for being here. Your presence has made this meeting impactful. Please do remember that we have a session on Twitter X tomorrow. Thank you and have a good evening, everyone. Bye.
Thank you. Good
Bye.
evening.
Thank you.
Thanks, everybody.
Bye.
Bye-bye.